Underactive thyroid disease, or hypothyroidism, is one of the most common medical problems in the world. In fact, the tablet to replace thyroid is the most commonly consumed tablet in the world. In America, there's between 15 and 20 million individuals with hypothyroidism. Most are women, about 10 to 1 women to men. And most of them came from families where either thyroid disease or some other form of autoimmune disease occurs. There's nothing the individual has done to merit hypothyroidism. Why it happens, we don't really know, but it certainly happens very commonly. The symptoms are rather nonspecific. Usually it's fatigue, maybe weight gain, feeling cold, bowel habits slowing down, basically slowing down in all its various forms. But any symptoms, either mood symptoms, energy symptoms, deserve a test called a TSH, thyroid stimulating hormone. It's a very inexpensive test. You don't have to be fasting for the test. It could be done in anyone's office. And if it's abnormal, in this case if it's high, that means you have underactive thyroid disease, and you have a little party because you're going to be better, and you're going to be better for just a few dollars a month. If that test is normal, and especially if it's normal repeatedly, then your symptoms are not likely from thyroid disease. And this is equally important to emphasize. And some people just get tested again and again and again because they can't let go of the idea that wouldn't it be so nice to have my weight gain and fatigue be easily treatable. In fact, thyroid hormone arguably should not be by prescription. The reason it is by prescription, at least in America, is that people used to abuse it. They abused it trying to get the weight loss and the endless energy that it really doesn't confer. I tell my patients, if it worked for that, I would take it. It doesn't work. And people have actually hurt themselves taking too much thyroid hormone. But it comes as a tablet. It should be rather inexpensive. Most people can get by with generics that cost just a few dollars a month. Some people who are very sensitive need the brand name. If you have the disease, then the key is to get exactly the right amount of thyroid hormone. And that can be a bit of an art as well as a science. This test, TSH, normal for a young person is between, let's say, 1 and 3. As we get older, maybe up to about 5 or 6. But within that range, you may feel great at one end of the range and not great at the other end. So it's important to monitor periodically, and in between, just be sure that you take your thyroid tablet every morning, and this is important, on an empty stomach. Any food or any vitamins or minerals taken at the same time will interfere with the absorption of thyroid hormone, and you get fluctuating levels instead of the very smooth levels that you really should get. So again, if you're not sure if you might have underactive thyroid disease, if it's in your family, it's a simple test, and if you find it, hooray, you're going to do really great on very inexpensive therapy.